the Chief Administrative Officer, Mbale District Local Government. It's my pleasure to stand in front of you and welcome you to this meeting. Mbale District gave birth to several baby girls that are represented here, but recently it also gave birth to a bouncing baby boy in that city. So, on behalf of the district, I'd like to welcome you to the city of Mbale. You're most welcome. I would like that you are doing in Uganda for the good of the communities, the people of Uganda. Thank you so much. All the partners who are supporting in various ways, we appreciate the support, and we hope that at the end of it, that support will have a positive group, dialogue on family planning, and more so also to get information. That is, there's going to be dissemination of information as far as the survey that was conducted some time back by PMA.
You see that unmet need in 2020 was about 21, and when we came back, it had also increased. But also interestingly, the most dramatic change was in Bukedi in terms of women who wanted to have a child within the next 2 years. These are what we call fertility desires. If the fertility desires are high in the country, people will have many children, even if they intend to. By the way, it doesn't mean that when we have 5, 6, 7 children, we don't intend them. You can have 9 children intended. Okay? If you have the resources to support the 9 children, it is okay. But we also need to know that they will strain you. Okay? I have one daughter, but sometimes that's the month we had a delay in salary, and there are some struggles in paying fees. Sometimes you feel the pinch a little bit. And I'm a teacher, but a teacher at the university, the salary is not so bad. But you still feel the pinch. Okay? Professor Makumbi told us he has 4 daughters, and he was feeling the pinch still, because the salary delayed by only 1.5 weeks. So what if we are out of work? What will happen? So what about the average person down there? If you have 9, can you really take them to school? So if we give people that message proper, maybe they will appreciate that have the children planned, but the children you can support very well.
Okay, so we conducted a survey in September 2021. The survey is called Performance Monitoring for Action. It's a family planning survey that monitors national indicators, key indicators on family planning nationally. And we've been conducting this survey since 2014 in Uganda, in all regions of the country. So today we are in Mbale to disseminate these results for Bukedi and Elgon regions in comparison with the national indicators. We have seen in this most recent survey that 58% of married women, or women living with a partner as if married, are using a method of family planning in Bukedi and in Elgon sub-regions of this country. These 2 regions are performing much better than the rest of the country, than many other regions in the country, because the national indicator is at 50% of married women using a method of family planning. We have also seen, however, that a quarter of the married women are actually not using any method of family planning, but they don't want to have a child within the next 2 years, and that's a bad indicator, because you don't want women or couples not to do anything if they don't want to have children, and that is a quarter of married women in Bukedi and Elgon sub-regions. But again, this is slightly better indicator than the national average, and we've seen that the quality of family planning service provision in the region is lacking, and that is where our DHOs, the team that we brought around here to disseminate the results to, are going to work at improving, because we see that only 38% of women who are using the modern method of family planning, when they come to the facility, only 38% are actually told about availability of other methods. They're told about side effects, that potential side effects of that method. They're also told about what to do when they experience side effects, and also possibility of switching if the method is a switchable method or if it's a permanent method. And if you don't provide the right quality for the users of family planning methods, then these people are not going to be good advocates of family planning. Because if I'm not counseled and my neighbor is experiencing a problem or they want to come to family planning, I'll tell them no, because I've been using an injectable and I've been bleeding for 2 months. I was not told about the possibility of this happening. Or I have not seen my menstruation for 3 months and I was not told that this is a possible side effect, but it will not kill you. It is not as bad as having a child you don't want. So what we see in the result is that 46% nationally, 46% of the last pregnancies were unintended from the 2021 survey. That is a very bad indicator because it means literally almost half of the children that were last births that were born were actually unintended, and about 13% were not wanted at all, and that is a terrible, even worse, because it means I had 4 children, I didn't want to have any, or I had 6, I didn't want to have any. The 7th child was not intended at all, and I didn't want to have them at all. And that means that you're going to struggle to feed them, you're going to struggle to educate them, we're going to have a poor quality population. And today we had people from the National Population Council who are presenting what we call harnessing the demographic dividend, which means we need to make sure our young people are very well educated, they have the right skills and the jobs. But if you have children you didn't intend to have, that means we're going to struggle to educate them, to be able to have the right skills and then develop the country further. So that is basically the summary of what we had today.
Robert, I work with the Ministry of Health in the Reproductive and Child Health Department. I work as a principal medical officer. Basically, in regards to the family planning situation in the country, the biggest crisis is actually around the escalating rates of teenage pregnancies. And of course, even before the COVID-19 pandemic, we had a quite high burden of these young girls, the teenagers who get pregnant. But we saw that the pandemic escalated this, and so even in the meeting you had the National Population Council stating that we have countrywide an average of about 1,000 girls who are actually becoming pregnant every day. It's quite alarming, with an annual statistic of about 350,000 young girls becoming pregnant. And for now, of course, we know that even among adult women, we also see many of them having unintended pregnancies. But of course, it's more alarming when you see such a huge number of young girls becoming pregnant. So in terms of the family planning gap, and I know you ask why is the uptake low, largely what we are seeing as a major contributing factor to this low uptake is the issue of myths and misconceptions. Even in this meeting that we had, the dissemination of these results, you could see that even among leaders, LC5 chairpersons, the chief administrative officers, they still have misunderstandings. For example, somebody to describe family planning as a program that the Muzungu is investing in heavily to reduce Uganda's population is a clear myth and misconception, because family planning is really all about ensuring that families have, children by choice, not by chance, and they are also able to produce that number of children that they can agree upon as a family, that their resources will be able to really, support. So the other issue that is affecting the uptake of family planning in the country is the issue of the side effects. And there's sometimes lack of adequate information as we, enroll these mothers, the men, on family planning. So sometimes, let's say if you get an injection and the mother bleeds, and she didn't have that prior information that with this method you can have side effect X or side effect Y. So that tends to, and negative information spreads much faster. So that mother who's experienced that negative side effect is more likely to discourage many more others. And yet we know that even with the medicines, take an example of Coartem that we use to to treat malaria. You know, you can take Coartem and then have nausea, feel like you want to vomit. You can even get a slight headache with the Coartem. But the most important thing is the reason why you are taking that Coartem, you know, to kill the malaria parasite so that you get cured of malaria. So that also comes out as a major factor in hindering the uptake of some of the family planning methods. So largely it's really the myths and misconceptions, and we see that countrywide they vary from region to region. So even as we intervene, we make sure that we have an understanding of which particular myths and misconceptions exist in which particular part of the country, so that we invest efforts in busting or demystifying such myths and misconceptions. And as a country, we have also done a lot, again working closely with partners to address issues of commodity stocks. Of course, we know that there are sometimes stockouts of some of these commodities at the health facility level, even when these commodities are available at the national level. And so our efforts have been invested in ensuring that we have, you know, a commodity security. We want to ensure that we have a wide range of these family planning commodities accessible and readily available at all healthy facilities. So it's really, the other aspect is around health worker bias. We know that sometimes health workers have attitudes, and they also tend to bias and discourage some of these clients in taking up these methods. But also there are skills gaps among some health workers, especially when you look about provision of some long-acting methods like the IUDs. You find if a health worker actually has a capacity gap in inserting an IUD, even in the course of counseling, she may not be able to bring the IUD as one of the options, just because he or she has a skills gap. She's like, what if this client accepts an IUD as the best choice, and then I can't insert it? So the efforts we are working, we are working at facilities to ensure that, one, we build the capacity of health workers in provision of these methods. Some methods require a higher level of a skill, like insertion of the IUD. And so much of what we are doing as a Ministry of Health is to ensure that we skill the health worker. We are getting a lot of support from a number of partners in addressing this capacity gap, the commodity gaps. Government is also committing, but though the envelope still remains thin, and I know that you had the discussions around commodities, the domestic financing for the FP commodities. Much of it has been through the partners coming in to support, but increasingly we have the World Bank loan, which is a government of Uganda finances coming in to procure some of these commodities. But also as a team, we are continuing to engage government to increase the financing, the funding for the domestic financing for the FP commodities, but also for the entire family planning services. We are also, the other thing, as probably I wind up, encouraging and building capacity of health workers to become more comprehensive and friendly. Sometimes some of these clients show up, but they've raised issues of attitudes among health workers. But the capacity building is quite comprehensive, trying to ensure that health workers are more responsive to the client needs when it comes to family planning. And the leadership is going to be very key in addressing, how do we get to the communities? How do we ensure that this right information on family planning trickles down to the communities? And that's why in this dissemination, you saw the culture, we had some cultural leaders, religious leaders, the political leaders. So leadership, in my own opinion, working in a multi-sectoral approach, having everyone come on board, is more or less going to be a magic bullet in addressing the issues around the low uptake of family planning, and ensuring that people understand that family planning is for the benefit of the family. The family should have families, the sizable number of children. If you want 10, if you want 12, if you want 4, ensure that you produce children by choice, not by chance, but children whom you will be able to take care of, so that we are able to harness what people commonly term as the demographic dividend, the country realizing its economic potential. And of course, I think in that regard, we'll be able to achieve Vision 2040, where Uganda will be transformed into a middle-income country. Thank you.